pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. I have a motion to approve the agenda.
So moved. Second.
Any comment? All in favor, say aye.
Aye.
We have now time for public comment. Ken, do you want to manage that?
Yeah, so we have several callers. If anyone's calling in for public comment, please dial *9 on your phone to indicate you wish to speak.
There'll be public comment at the end as well.
No one has virtually raised their hand yet.
All right, we have a motion to approve the minutes of the July 15th, 2020 Board of Education special session meeting. We have a motion
So moved.
Second that with the request for the revision that Dr. Taylor asked for in email. Can you hear me?
Yeah, thanks, Victor.
Maybe you'd like to tell that, Andrew.
Yeah, sure, I'll read it. So there's just a line, I don't know. So I'll read the actual, what the statement was and what their change of the request is. It says, Dr. Taylor explained that it would be extremely unlikely that you could say that any lunch wave would be safe from another, as they have now found that the virus is airborne. And it's just a few words that I'm requesting to be changed. And for it to read, Dr. Taylor explained that it would be extremely unlikely that you could say that any lunch wave would be completely safe from another, as there is mounting evidence that the virus is airborne in confined spaces. So just a clarification.
The motioner accept that motion change? To the minutes?
Yes.
Second?
I second with that change already in it.
Okay. All those in favor of the motion as amended?
Aye.
Aye.
Aye. And as the full motion now? Aye again?
Yes, aye.
Aye. The next board meeting is next week, July 29th at 6. Kath, next.
Okay. Just want to make sure that I can share my screen, Ken.
Should be good to go.
Okay. Okay, let me get rid of you guys. All right, before we start the review of the plan that we'll be submitting to the State Department of Education on Friday, what I wanted to say is that, you know, we've just been gathering information, changes, working around people's schedules, and we'll just do final edits, make sure our table of contents is aligned tomorrow, and get an emailed copy out to the Board of Ed so you can really kind of have a comprehensive look at it. Tonight, I would suggest definitely, well, let's have some dialogue and conversation on this, but either, you know, using your phone or a piece of paper and a pen, jotting down any ideas or questions or suggestions that we might have as we go through this. And I'm saying this because this process that we have been engaged in as administrators, planning and response teams, school group work teams, the health director calls, it's easy to look at some of these things, first of all, in isolation and so deeply that we can get a little bit stalled, and it's very complex and dynamic. So it just seems like it works for process to kind of jot those things down and go like, wow, that doesn't make sense, or I think maybe you need to add that. Procedurally, we we're not required to have the plan approved by our boards of ed, which, I thought initially was a little unusual. Bob shared the most recent CABE correspondence on this. It's really encouraging the boards of eds to approve the plan. The plan that will be submitted to the State Department on Friday is a draft plan for all of us. So I think, that it's really probably for everyone's protection, and as a vote of confidence on the contribution of everyone who has contributed to this plan, including all of you, that at some point the board does approve the plan, and not necessarily next week, maybe the week after, but I do think it's important as we go into the school year that the board's approval is part of this. So, rather than kind of taking the plan and summarizing it and putting it into a PowerPoint, we're just going to kind of have a guided tour through it. And so let's get started. The plan is divided into those 6 core areas that we've been talking about for the past few months. The first being supporting the well-being of students, staff, and families. And this is a requirement of the state's plan that we have this section and that we purposely look at this. As you know, because we have had a focus on well-being for 6 years in our strategic plan, that's just kind of characteristic of District 13, that well-being is the foundation upon which all our success is built. So it wasn't a hard place for us to start as a team as we began planning. And as I've commented to the board before, we have curriculum and we have processes and procedures in place in district that we will continue to use. Kind of our theory of action is that if we continue using a plan that we've implemented in the past, that our teachers know, our students are familiar with, that will be more successful in meeting some of the more unique and individualized needs that we're going to see coming in the fall. I will say that our number one focus is helping to protect yourself and others by following the CDC guidelines, which for us also includes a self-certified checklist that will be a part of Parent Square. Right now, our 12-month employees do a self-certified checklist that I created. It's just a simple Google form that they go in and fill out every day, attesting to not having a temperature over 100, and to all these areas. We will be working with Parent Square and all staff and students. And at this point, it will be a recommendation to parents that they use the app on their phone to self-certify that their children don't have these symptoms, and that if they do, that they stay home. So the Parent Square app that we anticipate coming out probably by the middle of August is something that you can just pull up on your phone. We have found that just for our 12-month employees, they're paying attention to these things, how they feel, and maybe paying attention to a symptom that they might have ignored previously. We also obviously, and like go into this in greater detail about the process we'll use for reporting any type of illness to the school, so that we're keeping very careful records of attendance of illnesses, and that is part of our database and ultimately could be a part of our effective contact tracing. We want to make sure, as we're trying to kind of manage the movement of students within the building, keeping kids basically in their classroom, especially at the elementary level, and reducing the amount of movement around the building just to minimize the spread of the virus and diminish face-to-face contact. We want to make sure that we're building in mask breaks and just movement breaks and any opportunity whatsoever for students and teachers to be able to go outside. We're very fortunate to have very strong partnerships with our community agencies, just like Durham Middlefield Youth and Family Services, who we've been working with throughout this. Also important, something that was brought to our attention that we need to, which is something that we do yearly anyway, but really provide that professional learning around recognizing situations of abuse and neglect and reminding staff of what their responsibility is for that. I think you're all acutely aware of the concerns that all staff have, whether you're a teacher, whether you're working in a school building or not, anyone who's re-entering a work situation where there are, hundreds of people, there are some concerns. And if you read the CEA document that Dr. Taylor forwarded to you, you see the significant concerns being voiced by teachers. What this has done for us is to really help us understand where it is that people may be struggling. And we want to make sure that we're providing our staff with the same kind of support that we're giving our students, which will include extensive training before the start of the school year, the provision for a modified work schedule or potentially to work from home if they meet certain designated criteria for a leave. Bob Yamartino, I want to thank you so much for recognizing the hard work of the staff and certainly the kind of the physical toll that it's taking on some people more than others. Our custodial team has been incredible. And I will show you later the cleaning and sanitizing protocols we're following. We're taking this very, very seriously, and we feel that will contribute to people's, not only their physical well-being, but also their mental well-being, knowing that they're coming into an environment that is clean and healthy. Part of the thing that I have done that I think has helped to contribute somewhat to people's health and well-being is just to keep up with communication, let people know what we're doing, how we're doing it, and to be sure that they're apprised of what's happening each day and each week, which is pretty mighty. And I want to make sure that people understand that we're working tirelessly to address these issues. Something that we will implement in the coming school year is safety ambassadors in each school, so that if there are any concerns whatsoever that a staff member wants to share and perhaps doesn't feel comfortable going to an administrator, that there's a safety ambassador that they can go to and share information with. We also have various systems of support that we have for all of our staff. We also will have 2 people per building who will be in charge of the oversight of the various training that all of our staff will need to have. Our administrators at the high school came up with this idea, and I believe my other administrators are going to do this as well, and that is to have a weekly virtual office hours just to drop in to talk about any concerns that they may have. Bloom Shapiro is working with us specifically to create a staff reentry plan that has just kind of organized in a very comprehensive way everything that we're expecting and the details that are specific to our staff, from food service to custodians to teachers to paraprofessionals. We also met with them today to try to isolate that to a couple-page FAQ so that we can have a kind of an at-a-glance information for our teachers. Our healthcare, our insurance company is also a really great source of support for our teachers. In terms of how we're supporting our families, of course, I think, adhering to the plan and staying in really, really close contact with our parents about everything that's going on. We know that there'll be probably a heightened degree of concern if we're back in the school full-time in the fall. And so we want to be sure that we're doing daily check-ins with parents when we can from our school administrator, and some pictures just so people can see that, you know what, your child is okay, he or she is safe, and we're doing okay. We also want to make sure, and this is a requirement of the state plan, that we really keep parents engaged, and not engaged just because we're all concerned, but engaged in a really positive, proactive way. And as some of our parents on our PTO, on the PTO at Brewster asked the other night, hey, can we start fundraising? Well, we want to make sure that we're still engaging parents in a lot of different activities to the extent that we can, because they're part of this school community. The next area of our plan talks about spread mitigation. What are the procedures that we will use to address all the safe hygiene practices that have been shared with us in terms from the CDC as well as DPH. So the DPH has a cleaning and disinfecting school guideline. And, you never thought that you would need to talk to people about what it means to clean, what it means to sanitize, and what it means to disinfect. We really cleaning and sanitizing is, cleaning is what we want to do when people are in the building. Some sanitizing while folks are in the building using less toxic chemicals. And you really don't want to do the degree of disinfecting that we may need to do while we have people in the building. Restrooms will be disinfected twice a day. We have a sign-in sheet located in each restroom, and when the cleaning is done, that is noted. All classrooms and all touch points and will be cleaned and disinfected each day. I won't go over this in great detail, but we're using approved cleaners, and we've designated those that are for staff use. And, because we know, for instance, today we were talking kind of in depth about the protocol that will be used at the high school level, where we feel that kids can safely spray a desk, wipe it down with paper towels, throw them out before the next class comes in. And we, in that case, we want to make sure that even our high schoolers are using assigned seating. So these are the other types of the approved peroxides and green cleans, the disinfectants that we're using, and the fact that our disinfectants really need to have dwelling time, which before this, I didn't know there was such a thing called dwelling time for disinfectants. But this is, believe it or not, something that we need to think about, because 10 minutes is a long time if you're thinking about using a space in terms of scheduling. For instance, a meeting room that's been used by a group that will then be used by another group. And then the sanitizer, just some of the details about the sanitizer. Oh, geez, here we go. Okay, so in terms of our physical plant, in terms of how we're cleaning all the touch points, and when we talk about touch points, the stairwells, the railings, the doorknobs, light switches, towel dispensers, there are certain touch points that probably the best way to deal with them is to reduce having to use them whatsoever. Propping doors open that we can, having light switches that you don't have to touch. towel dispensers that, maybe we're just leaving towels out or using individually separated towels. If you were on the planning and response team, which Dr. Taylor and Bob Moore are both a part of, that our head custodian created a system of color coding the various types of cleaning, disinfecting, and sanitizing agents with the various types of cloths that they need to use. We did have a conversation today because when we look at the team of custodians we have and the volume and the schedule that they need to follow in order to keep up with the protocols that are recommended, we've talked about whether or not it would be a good idea in some schools to be able to keep certain bathrooms closed in the morning so that the bathrooms that are used in the mornings can be cleaned and disinfected. And then in the afternoon, we can just open the other bathrooms. So these are kind of some of the logistical things that our facilities people, Sue Gaudreau and Jimmy Croto, will be talking with our administrators about. Obviously, hand sanitizer is a big deal, and we have plenty of it. Our entire building will be stocked with hand sanitizer. We always say that hand washing is preferable over hand sanitizing, but it's available for use for everyone. We have talked about whether or not with our little ones, we really want that hand using the dispenser, either the teacher using the dispenser or monitoring it, because sometimes kids really like to pump that sanitizer, and then we've created a different cleanup, which we're trying to minimize. All the movement, I think I talked about it as being choreographed. That was probably a little dramatic at last board meeting, but in terms of how we're moving in the classrooms, how we're getting off the buses, which doors we're coming into, when are we passing time, we're trying to minimize face-to-face exposure to the greatest degree possible. The one-way foot traffic patterns will be followed in school. We really don't want to put tape on our floors, and we feel like in the elementary schools, kids aren't moving about the buildings generally on their own. They're following their teachers. And we're trying to actually create traffic patterns so that we're not having the crisscrossing and walking by people. All of our schools and offices have all the designated signs that we need to have. We'll also be using daily age-appropriate announcements, reminding staff and students of all the various guidelines. Anything that's posted, any announcements we're giving to kids will also be on that school reopening web page, which you can find at the top right-hand side of our home page. It just kind of talks about what's happening in our classrooms and offices. And just to take a minute here, because we really explored this further today in our administrative meeting, in that we have encouraged our teachers to come into the building, and we are going to designate one of the days, any day in August, because we've got some flexibility with those additional 3 days that the state board approved our teachers have a teacher work day, and that day is generally right before the first day of school. We'd like to move that and make it a self-selected day so the teacher may come in, go into their classroom, arrange their furniture in a way that meets the recommended guidelines of all desks facing in the same direction, the greatest distance possible between students, and the removal of extraneous furniture and stuff. Sounds like a great idea. It is a great idea. Related to that is we need custodians to be able to move furniture, and we also need a place to store furniture. It's looking like in our schools, if we're removing kind of extra furniture and materials, that we'd need to use our gymnasiums, or at least part of our gymnasiums, to store to store furniture. So that is underway. We'll be communicating with teachers about that soon. As you can see, the instructional design is also something that we feel is going to contribute to the kind of healthy protocols. Teachers wearing masks at all times, unless they are outside of the 6-foot proximity, whereby they can use a face shield or a physical barrier or a plexiglass divider. We have not purchased plexiglass dividers at this point for our in-class, in part due to the pretty significant cost and the fact that we feel like with our face shields and the distance, when students really need to see a teacher's face, which I think is basically every day, but in particular, as students really need to be able to see your mouth. And then this just talks about the types of cleansers and peroxide sanitizers we're using. At this time, we're talking about our elementary students eating their lunch in the classrooms, and we've gone over in great deal kind of what this will look like and how we'll minimize ants and crumbs on the floor, but so that students can safely eat in their classroom, and then teachers at the younger level will be able to assist with wiping down their desk or table area. We've talked about the cafeteria and whether or not, and again, Dr. Taylor, I appreciate your comment last time, and we did go back just to look at if we were to use our cafeterias at Strong and at the high school, in what way could we use a large space for some of the students in any given lunch wave as one of the possible areas. We found out today, I'd like to thank Kim for reaching out to Dan Merriman of the Durham Fair Association, who said that they will lend us tables for outdoor eating. So I think actually all of our administrators will probably take advantage of borrowing tables from the Fair Association. At this point, all of our drinking fountains and even the filling stations that we have at the high school have been turned off. Water obviously is available in classroom sinks. We've talked about different protocols we'll use for the little ones with Dixie cups. Obviously, kids can bring their own water from home, and we will have cases of water available in classrooms. We definitely don't want any child to go without hydrating during the course of the school day. We have obviously nurse's office, and we will have isolation rooms that certain students with certain symptoms will need to be in an isolation room where they'll be supervised because of a suspected case of COVID and showing symptoms. And obviously there's a cleaning protocol that we have. We also have cots that are, I think have been stored at Corn School from our emergency management department, whenever we have to use our buildings for a shelter, and that we'll be able to use those cots in our isolation rooms. Everything you wanted to know about how to clean bathrooms, and I'll tell you folks, this is an area that we've had lots of conversation on because of we want to maximize the efficiency of cleaning, the time that we're doing the cleaning, and the effectiveness of the cleaning. So, and again, taking into account the 10-minute closing for dwelling times. We won't be using our locker rooms, and the entire lower level of Cog and Chog will remain closed. Playgrounds, it's just ironic that you can, make such a marvelous progress in playgrounds and playscapes just at the time of a pandemic. So we have spent quite a bit of time looking at what is the protocol, because we're going to have some great play area for students. We want them to be able to use them and not just look at them. Initially, we were told that we could use a fogger between cohorts going outside. We have learned that disinfecting is not required for outdoor equipment. And what has been suggested is just hand washing before and after use. This is an area we want to look a little bit more at in terms of whether a cleaning protocol might be a good thing to be using on our playscapes and equipment. Ventilation, those of you who have been on focus groups or have seen my responses to some of our email know that people have questions about the ventilation system and also have suggestions and ideas. This gives just an outline of our ventilation system, how we operate it, the fact that there's a provision to take in more of our fresh air from outside, how we've changed our air filters in order to increase the filtration. We think, Jimmy is absolutely on top of this system, and I have every confidence that his confidence that this does meet the state of Connecticut DPH ventilation guidelines and is monitored very closely. Our water systems do comply with our return to service guidelines. In terms of our PPE, staff are encouraged to purchase their own cloth masks. Everyone who has come into work so far has done that. We will provide a mask with our logo to each staff member. Those of you who know that N95 masks, although they're worn by people who happen to get their hands on them, they really do need to be med and fit tested. And Pam Bransford, our clinical nursing supervisor, has found a contact at Middlesex who's going to be able to do that for our nurses and our custodians as appropriate. Parents are asked to purchase masks for their children, but really to get a sense of what kind of fabric and fit a child will tolerate. But of course, we will have masks here at school. The shields, obviously we have for nurses, and we actually have an order for 250 of the clear shields, because we think that that's going to be something that many of our staff will use on a regular basis. So we definitely are asking some people to test drive that for us this summer. These are just the different types of PPE, and at this point, goggles and glasses haven't been requested, but we've got them if people need them. Gloves, we have plenty of gloves here. Gowns would only be in a pretty significant situation where nurses or staff may come in contact with bodily fluids. Some people feel that if we're at the point where gowns are necessary, we probably won't be in school. Part of the reason the State Department has given us additional days is to really make sure that staff have adequate training. We will provide all the recommended training, both online and in person. And as I mentioned earlier, 2 people at each building would be designated as point people. I've talked to you about social distancing for children. We're also, really it's not encouraging, but this is our protocol for, maintaining 6 feet distance from other staff members. We really are erring on the side of caution as extreme a way as we can when we first come back to school, to the extent that we will even try to hold any of our PLC or department meetings remotely, even when staff are in the building. big question that we've had from parents is this, our practice of cohorting, and to what degrees we are going to be able to maintain cohorting, keeping a group of teachers and adults together, just kind of a consistent schedule through the day. And from pre-K to grade 5, it's much easier to keep kids together at an elementary level. In the beginning of the year, what we'll do is we'll have our gym teacher, music, library, and art will actually be coming into the classroom to provide lessons to students, just to minimize their walking down the hall and being in another learning space. Of course, a child will have another cohort if they ride the bus, if they get speech services or OT services, which you'll see later in our plan about how we also are trying to maintain stable cohorts as we deliver special education services. In grades 6 through 8, the cohorts will be that students will have a cohort for their core academics. Those will be the students that they travel with for science, social studies, English language arts, and math. And then another cohort for their unified arts. They'll be with a different group of kids for their, art, music, phys ed, etc. And then a third cohort for world language. To the degree that we can, it will be established in the high school. Very, very difficult to do. And in the absence of school cohorting, we're just really paying even more attention to the other methods that need to be used. These are just some of our health practices and protocols. The primary we know is the maintaining the wearing of masks and the frequent hand washing. So we're making sure that this is a part of everyone's staff and students, just part of their daily schedule. In terms of immunization and health assessments, I actually should have a live link there for you. Information was sent at the end of June to all parents about the requirements for immunizations and health assessments. In this area, we talk about how we're addressing reporting illnesses and addressing vulnerable populations. And I believe that we will be sharing information with parents about attendance and, reporting an illness, how we're documenting that. It's also permissible for us to ask staff if they're experiencing symptoms. And I did already talk about that self-certified checklist, and always with the encouragement to see a health service provider if they're not feeling well. Our clinical nurse supervisor is our safety compliance liaison, kind of co-leading with her the kind of communication points for me, but she has been absolutely outstanding in her initiative, her organization, skills and knowledge. And if we have a reported case, either she or I will have immediate contact with our local health director. Again, we will share in the survey that goes out to staff and students what kind of modifications and supports are available for anybody with a vulnerable population. There's an entire health monitoring plan, which I'm going to just briefly show this to you, but this is probably something that the board, when you receive this tomorrow, you'll want to take would like to take a good look at. and and also our parents, just to see the comprehensive nature of how we will, how we will address all of these areas. And we kind of, we have a checkbox in order to make certain that everything that we need to address in order to meet all the health expectations are in place. Oh, didn't mean to do that, guys. Sorry, brief interruption. Okay. Okay, so in terms of our protocols for our visitors, really what we're doing, and I believe the board reviewed a policy this evening, although I wasn't a part of the policy meeting, about really reducing and restricting the visitors that come to our building with, will not have any kind of just pop in. However, we do have, we will call them visitors, who are actually service providers. We have students who receive special education and support services from outside service providers that we will have a protocol that they'll be able to follow. We also will be installing our lobby guard, which is our new kiosk system. And when Kim gives any updates, and actually, Kim, when we get to the fiscal financial monitoring part, we can kind of give people a break from my voice, and you can talk a little bit about lobby guard. And actually, great timing. It was coming anyway, but it prevents people from having to come into the office, simply scanning their license, getting a badge, and being able to come in. In terms of our vendors and contractors, we really want to make sure that, to the extent possible, people, if we have any vendors or contractors, unless it's absolutely necessary, they're coming into our buildings outside of school hours. The contractors will be asked to self-certify their wellness before coming into our buildings. That will be something that they do with their employer, and their employer, in entering into a contract with us will have let us know that that's something that they use. And these will be kept by our Buildings and Grounds Department. If, oh, we're missing a bullet. As I have said to you, Dolphin Days is really moving along in the process of setting up childcare at Brewster, and they will clean and disinfect the areas that they use before and after, and following all of our cleaning protocols. In the area of operations and logistics, in this area, I would like to put a copy of our school calendar, especially because I believe and we can have some conversation about this evening or possibly next Wednesday and vote on it. Because we are approved to have 3 less student days in order to have 3 more staff professional development days. I didn't really want to put off the start of our year by 3 days. So what I'm recommending to the board is that we move the start of school from Tuesday, the 1st, to Thursday, the 3rd. We'll bring back students on a shortened day for Thursday, the 3rd, and Friday, the 4th. Our staff will have those 2 days for professional development day. And as I mentioned earlier, the 3rd additional day will be a day that's a self-selected teacher work day to come in and organize their room. Our transportation, this just kind of goes through the status of how we could operate our buses. And right now we are in a safe status, so that our bus transportation can go on without restrictions, but with additions. of really safely boarding the bus, unloading the bus, having a mask on, training protocols for both for our drivers and our monitors. And although monitors aren't required, as they were for summer school and in the initial plan we got, what we're planning on doing is for the first month of school, seeing if we have staff members whose schedule allows them to expand their hours. I'm going to say this, for example, we may have a support staff or somebody who works in our food service, so is kind of part of our district cohort that might ride the bus as a monitor as we kind of just ease kids back into this protocol, and also for us to see what's happening, what kids are struggling with, or maybe some different ideas for that. So this just outlines the protocols that we're going to follow for the bus and any changes that would happen if we went from a low to a moderate status. We just received from DATCO very comprehensive protocols, which I need to let you know. I think we received them yesterday, and I have not been able to go through this in a comprehensive enough way to be able to scroll and give you the Reader's Digest condensed version of it. What I can tell you, because I know that Kim has gone over this extensively, is that they have paid attention to all the expectations and have looked very carefully at what makes sense and how they can have students safely ride the bus. And again, this is part of the plan, so you'll be able to review that, and Kim may be able to talk a little bit more when she gives her report. We're really kind of appreciating parent transportation, and several parents indicated that they would be able to transport their child to school, thus reducing the number of students riding the bus, which is a benefit, although we are being told that students could safely ride the bus even if we were carrying a full bus of students. What this means for us is that we probably need to rearrange our, redirect our parent drop-off and pick-up patterns, which each principal is working on right now. We also looked at our schedules. In fact, this was a discussion this morning about how we can allow for a little bit of an earlier drop-off for parents, which that exists anyway. But really making sure that parents are aware that there's generally a 20-minute, before the start of school where parents could be dropping off students. We just recognize that a work schedule, being able to do that might allow you to actually drive your child rather than putting them on the bus. Late pickup for students, something we're looking at too, that seeing like, can we kind of extend that period of time, because we've got a parent who could get to the building in a half hour, but not within the time that we have right now. So we're looking at the late pickup to see what we can do. Athletics, obviously, we're still there are still guidelines, but we are set to play ball. The guidelines from June 29th are still in play for athletics, and that will guide all of our all of our game playing, unless there are changes. Just in terms of how we use the playground, what cohorts will go out, unfortunately, recess will not look like it has in the past, but we will make sure that students get outside and are able to have, probably what we'll do is kind of have different stations for different days. Okay, there's no disinfecting plan, I just told you, so we need to go through that. Our emergency drills, we actually have an emergency drill and exercise guidance plan for, given the fact that we want to social distance, and if you're doing a fire drill or a lockdown drill. So this link brings us to some of the protocols that have been suggested. Kim has talked to you about our the availability of our child nutrition program and food service, and what we have to do and what we will continue to do. If we go into the hybrid or distance learning, we still will have the parent pickup model at COG and CHOG. Free and reduced price lunches for those students and families who qualify will continue. We have discussed the meal delivery plans. I probably shouldn't say Mark's plans, our food service plan, Mark Basil, again, I talked about him last week, has created a very comprehensive protocol for his staff in terms of monitoring their own health, how they will, put the different meals together, and then just has created a pattern and a flow by which grab and go meals will be picked up. We have carts for delivery, what type of sanitizer will be used, a la carte offerings only at the secondary level. You can just follow that link to be able to see what that plan is, but a comprehensive plan. And I would say the part that we're still kind of looking at is what spaces we're going to be using at the high school and middle school. Because we have the tables from the Durham Fair grounds, that will help us at Strong to potentially provide some seating in the cafeteria, because I believe they're rectangular rather than round table. Kim, I'm going to take a little break from talking and let you talk about the fiscal and budgetary considerations.
Okay, I think first, if you don't mind, I'll talk about DACO, the follow-up on that.
Sure.
I have reviewed the plan, and I did give some feedback to DACO, asking about maybe some additional services or a little bit more clarity. Essentially, DACO will clean and disinfect the bus at the end of every day. They will put a sign in the driver's seat that says this bus has been disinfected, so that the next day when the driver comes on, they don't have to do it again. It's been done the night before. Clearly, if the sign is not there, the driver then needs to disinfect the bus before taking it out. One thing in the plan was that they were not going to clean between, not that they were not going to clean, but it wasn't in their plan to clean between tiers. They were just going to do it at the end of the day. I have asked for cleaning between tiers. So that is just, I haven't gotten feedback from them yet, but I thought that that would be something that, it said it was district choice. It depended on the district. DACO does many districts. Maybe some districts aren't going to require that. I think it's important. They're going to clean high touch surfaces, railings, tops of the seats, and such regularly. Also, one thing that I had asked was, do they have plans for a quarantine seat? Surely, with the best of intentions, a child may develop symptoms. Some of them can be on the bus 40 minutes and may develop symptoms on their ride. And do we have a seat that we can designate as a quarantine seat? Sanitizer, looking to install sanitizer stations or whatever it may be at the front of the bus so students can pump on and pump off. And for lack of soap and water there. So that's something I have reached out to them as well. All drivers, passengers, and monitors will be required to wear masks unless there's a medical exception, certainly. And there is monitor and driver training. So DACO is doing some training on their for the drivers and monitors, and any monitors that the district may be able to secure to ride the buses I've asked if they can sit in on that training as well. Certainly the monitors would be tasked with, are they wearing a mask? Are they, loading right from the rear of the bus to the front? Are they staying seated during operation? Unfortunately, that can't be, even in the best scenario, the driver needs to drive the bus. So that's what we figured that would be the monitor's task. Drivers need to self-certify every morning, checking with them if that's an actual form they're doing or if it's just a mental checklist. How do I feel every day? So getting clarification on that. And then what types of cleaning products are they using? I just need to know that clearly because I need to make sure that they're approved cleaning products. So those are just, like Dr. Serino said, we got this yesterday. I followed up today with my concerns or my questions, and then we'll hear back from them. Moving on to fiscal and budgetary considerations, the first thing would be to secure our funding. We have been able to, purchase some of our curriculum information needed with last year's funds, with 1920 funds. We also have the CARES Act grant that the application just opened up again today. District 13's only going to get about $43,000. It's based on our Title I allocation, which is based on a language actually from the grant needy population. So that we're going to spend 75% in curriculum, which is what I just mentioned, what we use in the 1920, and then 25% technology. The next bullet point is FEMA. We have an application into FEMA that will cover 75% of our expenses, and for things like the food service losses or really legal or any kind of expenditure that we may have had due to the unexpected school closure. Could be curriculum, could be supplies, could be PPE, all that stuff we have, we'll put in for it and hopefully get the 75%. Budgeting strategy, with that end of year surplus being a little bit higher than we had anticipated, earmarking that in the 2021 year, potentially for salaries or wherever the board may see fit to cover any kind of gaps in any additional. But also in that budget strategy is also to reallocate funds as needed. So we understand that, if sports isn't running, we're going to have a surplus in that area. We'll be able to target that for other areas if we go to a full distance learning plan. But even aside from sports, there could be any other combination of things that don't happen, and we're able to target those funds where they're needed. And that would be obviously through informing the board and getting a line item transfer approval. Engaging stakeholders, we have our committee meetings. We have the ERC that meets every 2 weeks, and also the finance committee where we have members of both communities. So getting other stakeholders involved really helps people understand the budgetary considerations. Funding priorities, health and safety clearly is keeping our physical plant clean, supporting daily practices, making sure that the staff has the PPE they need, right from what the teachers need, what additional needs might be needed at the preschool level, what the custodians will need are going to be different than what the nurses are going to need. So identifying each category and what their needs are. We've stocked up on our PPE, and then now what we'll do is we'll kind of test drive and see what works. Vendors are coming out of the woodwork with PPE. So, there are things that are a little bit harder to get, like wipes sometimes, but there's enough sources that I do think that we're going to be able to, reorder things anytime we need them. And then transportation, just making sure, okay, so now if we do go to a low or a moderate status and we have to start social distancing on the bus, well, if we are overrunning our buses because, the parents are transporting, great, that helps with the numbers. But, we could need to put a bus or two more into the daily run. So just kind of keeping an eye on that. And, that the cost of a, bus for the week is around $1,600 for 5 days. So that's for 1 week. If you can scroll up, Dr. Serino.
Sorry, sure. And that should say teaching and learning loss mitigation.
Yeah, so clearly that's very important. That would be what I spoke to, to whatever it takes, whatever kind of equipment or purchase services, salaries, certainly this is the area where we think that salaries is best spent. on loss mitigation, getting the kids to where they need to be. The social emotional learning, connections and engagement, again, would be through maybe a purchase services or some kind of professional development for teachers, to introduce to the students and support them. Technology, connectivity speaks to itself. Obviously, that's a priority area as well. We've done great. Our technology department has done great. We have enough Chromebooks either in-house or on order to have a one-to-one. So that's a great feather in our cap. And then food insecurity, provisions for providing meals regardless of educational design simply means if we've got everybody in-house, but we've got the families that choose not to send their students back, but they still do qualify for free and reduced lunch, they can come and pick up their lunch. And then if we go to the hybrid, a few days, or the full distance learning again, that will continue. We do have some waivers that could be available to us where we serve lunch for free for any student under 18. That will expire at August 31st, but there's very possible, and I do believe I've heard some conversation about that waiver could be available again. Reserving funds, adherence to the budgeting strategy. Clearly messaging to the staff that, don't buy the supplies you're going to need in May now, because maybe you're not going to need them in May. Maybe what you're going to need in May is going to look a little different than what it looks like now. So really just kind of, a lot of times the, staff gets back and they want to order their stuff for the year and be done with it. And I understand that, but, we need to sort of just kind of hold off on that a little bit for now. And then contracting, insurance policies, internal protocols. Obviously, MOUs with the unions are going to be a very big, issue in this area. And fiscal operations in terms of insurance, cash handling, that remains consistent. We're not really going to see any change in that area. We prefer parent square payments as much as possible. However, if there's no field trips or anything going on right now, there really isn't a lot of things for parents other than food service, lunch.
Thank you, Kim. Outstanding work on all facets of this. This section just will include and currently includes the policies that have either been added or revised that relate to COVID. Once those policies are adopted by the board, we'll put live links here, but for our staff and our parents, this will give a little bit of just an overview. And those of you who were in the policy committee discussed those tonight, and I understand made excellent progress. So we should be able to adopt these and share them with the public. We will share the proposed but not adopted policies on our school reopen website tomorrow morning. The next area that is required that we can quickly move through is coordination and communication. Jeez. Oh, sorry, people. Here we go. There we go. It's important and a requirement of the plan that we have a plan and we communicate it and we are coordinating. And I think that has been a hallmark of our progress here, that we immediately instituted the district planning and response team, which is something I did in March, and at the time not knowing just how important a body of major stakeholders would be. I think it's important. Sometimes people will say, the administration is sitting back and making all the decisions, which might be easier, but way less effective. And so you can see on our planning and response team, we have representation from key stakeholders who also represent all the groups in our district. We also, as you know, just began those school-based teams a few weeks ago once we finalized our district team. And again, I want people to be sure that they see that there's representation. There are teachers, the nurses, custodians, guidance secretaries, speech and language pathologists, PE teachers, who are all contributing to and looking at. You take everything I've just discussed, there's an implementation phase and an implementation plan that has to happen at each school. How will kids go to the nurse? How will we let a nurse know that a child is coming down the hallway? Will someone be walking with them when necessary? And just every detail now needs to be operationalized within the building. So these are the folks who we're working with. And as I had shared with the board, we did decide that people needed to be compensated for the work they were doing in this planning. So we are paying people the curriculum writing rate. And again, I think it's important that people know that there's representation. In terms of the communication, we started a protocol and we stuck to it. I send a staff update on Tuesdays when we're in session. A weekly update to staff and parents goes out on Wednesdays. Director of curriculum gets something out on Thursdays when we're in session, and then our principals do a weekly update. We've been using Parent Square. I also just simply use a shared Google Doc or email for our staff, and then we receive information from parents on our school. We post everything on our school reopening page. Parents obviously can contact us by the Reopen 20 mailbox, and we want emails and calls. Any student-specific, child-specific question you may have can be directed to them. And as we move into the, talking about distance learning, if we go into distance learning, that team began meeting before we were finished with distance learning 1.0. to begin to look at how we could enhance and just in general make better the distance learning experience for everyone, but primarily our children, if we are to have to do that again. When we talk about teaching and learning, then the next section, I do want to talk about this because I think it's important, and it's something that's going to be a very real part of the implementation of any of these models that we've been asked to develop by the State Department. And that will be the negotiation of a memorandum of understanding with our teachers union. And the teachers union had a draft MOU that they created about a month ago. The CEA just put out a publication that's called the Safe Learning Plan. They have 6 recommended requirements that they're sharing at this point, which includes allowing the school to begin a year through distance or remote learning where necessary. Testing they would like to see testing, COVID testing for all students, teachers, and staff. They understand the importance of moving the economy forward, but feel that safety must be addressed first, along with a few other, what I would say is criteria. And that's something to keep in mind. This is a dynamic. Even if our health data was static, the process is dynamic. So we have a moving background and we have a dynamic process, and that dynamic process includes a negotiation, likely with all 6 of our bargaining units, and in particular with delivering an educational program with our teachers union. One thing that, I realized that I didn't really forget to talk about it, but the fact that I'm talking about it here makes it sound like the only place that we could possibly see an identified case would be in a classroom, and that's not true. It could be in our technology department. It could be in our central office. It could be somewhere where we don't have kids moving through the area. And at this point, the protocol that we are being instructed to follow with our health director is that if there is an identified case, that obviously that person and anyone who had contact with that person would be required to quarantine for 14 days. The actual protocol or guidance at this point is that the contact, unless the contact is closer than 6 feet for 15 minutes or longer with someone who doesn't have a mask on and has COVID, that's the criteria. Our health director feels that the criteria really should be more stringent than that. So contact in the same area with someone who's identified would trigger a 14-day quarantine for anyone who had come in contact with that person, whether it was in a classroom or somewhere else, which is why the documentation of any contact will be critical and something that we've developed a kind of a log and checklist for. So our plan in terms of our in-person teaching and learning coming back, obviously we have a curriculum that's set that we will follow to the extent possible. But following a lot of the guidelines that I've talked about in terms of how we're physically moving and managing throughout the building. When we talk about standards being prioritized to accelerate learning, we will talk about this in greater detail. Some of the kind of preliminary research talks about the fact that is a recommended strategy for moving kids forward after the kind of an absence of learning that they had before. And in accelerating learning, you're also needing to compact the curriculum. Both of those things are kind of monumental tasks, how you kind of condense the curriculum and change the pace of learning, especially given potentially less time with students if we're in a hybrid or distance model. And it's a new method. It's an altogether new method of teaching. I bring this up because I think that if you have not already seen this coming up as a theme, you will begin to see curriculum compacting and accelerated learning. When Mrs. DiMaggio talks about sensible assessment practices, this is something the State Department of Education is talking about, and our district is talking about as well. I'm trying to scroll down to that later. And, assessing children is going to help us to understand where their skills at. What are the skills that could potentially be addressed quickly and easily? How do we put students in skill groups to I'm trying not to say the words get them where they should be, because who knows where kids should be. We have standards for where students in certain classrooms would have been had we been following a teaching and learning schedule. So that's something that we will continue to look at. What does it mean to have students reaching a certain, basically a growth target, but important for us to be able to use some standardized formative and summative assessments. Social emotional learning lessons will be a part of our weekly curriculum with students in in every grade, used kind of addressed differently at the middle and high school through advisory classes, as well as the restorative practices at the middle school, and at Memorial using Second Step and communities, and using Second Step at both Brewster and Lyman. We decided to call what your children or parents are able to do once we come back to school is something that's called self-select hybrid. We're calling it a hybrid because if teachers are teaching in person and there are students who are doing remote or distance learning, it will be a hybrid teaching and learning model. Parents will be able to submit, if they're a form that talks about the reason why they would like to have their child remain doing distance learning. So when we talk about this self-selected hybrid, so what will that look like? How can a teacher teach a class of, a live class while simultaneously teaching a child who's at home? And so we actually have been trying some methods of some things that we thought would work great, miking the teacher while they're recording themselves. And so we've had some teachers who came in this week to just give it a try, worked with our tech team and tried some things and realized it's not as easy as it looks, nor is it as effective. So they've looked at a few other methods that they feel will be more effective to engage students who are at home. I learned about the Ziggy and being able to use a document camera to actually record yourself while you're presenting. What we are going to do with the self-select hybrid model is similar to what we will do in the hybrid model in general, which is to have a very clearly stated schedule for what will happen when, and that will include pre-recorded lessons. We heard loud and clear from parents, we don't really want to watch YouTube videos. That's demonstrating a skill or teaching new learning. While we will increase the amount of synchronous learning that we're going to be able to do in a distance learning model, doing that in a hybrid model will be a little bit more challenging, but we will have some of I will give you an example. And again, we are kind of in phase 2 of the discrete planning of exactly what that will look like. We will use people in different positions. For instance, some of our coaches who can record lessons on skill-specific areas at the elementary school. We will account for and provide some live learning and live check-in with the child's assigned teacher. We also will assign kind of a peer or buddy system for a student who is doing remote learning to have a connection with the student who would be in school every day. As we move to the hybrid schedule, and this would be if the health conditions indicate that, it's really not safe for all kids to be in school, and we should try to minimize the number of students in the building and in the classroom. We had been looking at a few different methods to address this. We are part of the LEARN region, which are our shoreline schools, as well as part of the consortium area. And all of those schools decided to follow this particular schedule, which would mean we're roughly dividing students alphabetically. And we're in the process now really of looking at, do we happen to have a school population that nicely just kind of cuts 50-50 alphabetically? You know, we might need to, you know, separate by A to L or A to P, which accounts for having, we'll just, you know, use Jamie Rohrback's girls, who would be doing distance learning on Monday, Tuesday, and Wednesday. And on Thursday and Friday, they would be in school. And the opposite would be true for students at the beginning of the alphabet. This schedule doesn't look very innovative or unique. We were hoping to figure out a way to get kids into school every day, just smaller groups, maybe running an AM or a PM session, which would include cleaning midday, having you know, running our buses twice as much. Collectively, our priorities were obviously maintain a safe and healthy learning environment, given whatever the health data is at that time. If we are in this situation, which many people believe could be very unlikely that we would even be in a situation that would require this hybrid schedule, we would need to have deep cleaning between the cohorts. And so on Wednesdays, with all buildings empty, that would allow our custodial staff to really go in and do a very deep cleaning. And then what we would do is trying to avoid Saturday as a day to bring folks in for overtime, but have our custodial staff perhaps be able to work later on Friday to do the same type of deep cleaning. This also allows, if you've been in school for 2 days, although we really don't want students to not be in school for a full 5 days, it gives your cohort a break. If you have come in, your last day is on Tuesday, you're not back in until the following Monday. We wanted to be able to support in-person teaching and learning to the greatest extent possible and give students as much one-on-one connection with their teacher, given the parameters of the model. We also want to maximize the number of teachers we have available, and perhaps a greater likelihood, if we are not in school every day, that we have more teachers available, or if we have teachers who have compromised health situations, that they can kind of bolster our distance learning. We're also really keeping an eye on, you know, I guess when I look at a model like this, I kind of get into my Kathy Serino respectful rule breaker, and not really a rule breaker, but if it were time to be able to expand within this model, can we bring our kindergartners in every single day? Can we begin to address populations that really need to be in the building and begin to ease that out? We're also keeping an eye on the data, what we're reading about our high school students being, you know, just in terms of disease transmission. Should they be in less frequently? Should there be fewer students in? So this is the general design of the model. I give you kind of the key tenets of our decision making. Also with an eye on, is there a way to creatively work within this to achieve some of those other areas? We're rounding the bend here, folks. As we go into distance learning, again, we heard loud and clear from parents, you know, and while some people said like we'd take less, you know, we're good with what happened, the majority of feedback was that, you know, kids wanted to see their teachers, and we think that's a good idea as well. So we will do the asynchronized pre-recorded lessons as well as synchronized time that will be scheduled so parents and students will know exactly what's happening. We have built in regular individualized feedback and formative assessments and an opportunity for more rigorous and accelerated lessons. As you know, Maureen Hamilton has been selected as our enrichment teacher and will be working with students, groups of students and individual students, as well as assisting us in creating more rigorous and accelerated level lessons for other students as well. And again, feedback that we will be using grades rather than just pass fail. I'm just going to give you a little bit of an example of what a schedule could look like for, we'll just take a 3rd and 4th grade schedule so you can see. This shows you that beginning with a class meeting, a live meeting, Monday, Tuesday, Thursday, and Friday. So students will be seeing their teacher. A word study lesson, which would be synchronous, a lesson that would be recorded by a teacher that the students know. On Wednesday, you'll see there'll be time for individual student conferences and with an expectation that teachers are able to meet one-on-one with every student once a week or once every week. My favorite time, snack time, office hours, obviously for our older, for kids at the high school, time for intervention and special education services. Related arts teachers on Wednesday will be offering or providing SEL lessons in second step. Again, some more asynchronous learning, 10:15 to 10:30, and then an opportunity for teachers to work with all students, but in a small group rotation. Also time on Wednesday for independent work, time for makeup work, and then doing some asynchronous writing lessons, again, small group, time for lunch, and you see the kind of the repeated pattern, and then time for science and related arts, and then some student independent work time at the end of the day. I'll quickly just show you an example of, we'll take you to the high school schedule. Okay. So Mrs. DiMaggio talked about in this section the kind of the design principles that have contributed to the Distance 2.0, the creation of that model. The State Department talks about sensible assessment practices because they do believe we should be assessing our students a little bit, probably, well, yeah, you can see it, but using diagnostic assessments, being able to deliver differentiated instruction, using formative assessments, offering tier 2 or intervention support, and then being able to deliver the IABs or district determined assessments. We have included here what our assessment calendar is. That was created last year with some fine tuning in terms of the assessments, the assessment calendar that we plan to use to, okay. I think we actually have a picture of it down here. It's embedded. And it's very small, but you can take a look at this to see the plan that we have to continue with our assessments. Special education, that obviously we have many parents who have asked us, have been extraordinarily concerned about the skill and learning loss that their students potentially have experienced. I will say I have gotten great feedback from parents. I'm extraordinarily proud of all of our staff, our special education staff, the challenges that they met and met with just great creativity for working one-on-one, delivering ABA services and speech services, and supporting children's learning, which will continue. A lot of consultation and collaboration amongst the various service delivery people, so that we're really looking at the whole child and where our kids are coming in and how to support them, and even being able to support some students who may be doing in person with some additional remote or distance learning just to supplement. The Mrs. Keene is trying to model our district approach with cohorting, just to try to keep kids in a stable cohort with their classroom, if possible, to have push-in services, and if not, to have kids come out either one-on-one if possible, or with the same small group, and again, adhering to the safety protocols that we're following. Obviously, all of our students will have a Chromebook when they come back to school. And this further talks about how we would move to hybrid learning if we have in-person time as well as out of school time, and really prioritizing when we are face-to-face with students. We have a small population of English language learners, and we'll continue to work with those students and meet the requirements as indicated by the State Department of Education, as well as what we would do anyway. People have asked about student conduct relative to following health and safety guidelines. There's a new policy that we'll be adopting, but always, always coming at these things with teaching and learning of protocols and supporting children first, and working through progressive discipline. We are, working on our physical education, visual and performing arts, and at this point, I can't talk about comprehensively what we will be doing, but I'm certain that in the next couple weeks we'll get there. Extracurricular activities have been postponed. In terms of our staffing and personnel, it's obviously everything will be organized by our contracts. Any negotiated MOUs will need to follow and adhere to. We must meet all certification requirements. That we don't have any lessening of that at this time. And we really are thinking about how best to use all our staff to support our safe learning environment and high quality education. And then finally, what we will do in terms of potential wave contingency planning. And, this is obviously working very closely with our health director, looking what's happening in our own community. We don't know at this time whether there'll be any differentiation of decision-making in terms of closing, which, you know, in March, that wasn't the case. The whole state closed down. So we're uncertain at this time whether if there were an increase in cases in another town, whether our school district would be able to stay open or move to a hybrid model. But we would work closely with our health director, as well as the state of Connecticut and the governor's decisions. And if we needed to move to another school closure, we already have a communication plan that would be further developed, time sensitive, and keeping people apprised and abreast of information. And then if we went to a reopening of schools, I imagine we would follow this plan with some potential tweaks and modifications. And that is, let me stop sharing. That's about it.
Just a little bit.
There's some research resource documents that will be included at the end of the plan, so that you can see where we, you know, what we used. And I do want to say one thing. People, you know, say all the time, you know, did you see East Hampton's plan? Did you see Bridgeport's plan? Have you seen this person's plan? And I started looking through other people's plans. And we have requirements we have to meet. I thought it was critically important that we write our own plan. We know our community, we know our students. And to write our plan means we know our plan. To contribute to the plan means we own the plan. To collectively work on this also means that we can say to the people who are going to follow us, you can trust us. We put something together that we believe in. And so that's what we did. That health checklist is very extensive, but we might not be here. I mean, we might be here till 9 o'clock, but I think that it's really important that we're able to go over that, and maybe at our next board meeting, really dive into the health checklist part of all of this. I'm open for questions and comments.
I just want to throw something out there before we dive into questions. Could we maybe have a Google Doc, like how we do for budget season, where that might be, I thought, easier. I should have thought of that, suggested it sooner.
That's okay. When we share this with you tomorrow, what we'll do is we'll put the various sections, subsections, and then you can actually put your comments right in there, or okay, however you want to do it, but we will do a shared doc for the Board of Ed.
And obviously, I mean, goes without saying, but, obviously, great job to you and to your staff and, all of the, various different groups that, worked on it. I know it was a big, challenge and, especially with all the information changing all the time.
Yes. Yeah, got some new stuff today. Thank you. Thanks. And thanks for the suggestion.
Thank you, Kathy. I know it's a lot of work and I know it's not over. What else? Anybody else have any comments for right now?
I just have a question. So is our plan right now to a full return if the teachers union agrees to that?
Well, I'm not sure if that's the deciding factor, that we are to go back full-time in the fall because there is an executive order for that. Whether there's a negotiation that has some sort of an impact on that, I can't tell you that I understand in what way the teachers union could divert this from happening. The plan is we are going back to school full time.
Okay, thanks.
Yeah.
Any other questions or comments? I know there'd be a lot to read and a lot to go over.
Was there anything regarding, whether it was the hybrid or full-on distance learning that you guys discussed in terms of different uses of technology platforms? I know a lot of, obviously just school districts across the country are using different things. And I know a lot of it has to do with privacy aspects. So has that been explored? And I also know, just from my own experience, I'm sure other parents as well, like I noticed like some of the things that we were using, they were like the free version. So like you couldn't get like the full screen of stuff, and you couldn't utilize other areas of like those particular apps. So I was just curious if that's been explored.
Absolutely. And Ken, can I just call on you just to maybe talk about a couple of the things that we have explored, as well as, there's a lot of things that we go, hey, Ken, look at this. This is so great. We should get it. And he goes, okay, let me tell you, this doesn't talk to this system, or this, if you get this, you have to get this, which doesn't mean we haven't ordered different things and made enhancements. And today, even just talking about the document camera and Ziggy as, as a way to go. So if you could just, generally comment on some of the things we talked about.
Yeah, so we felt, so Brendan and I did a lot of collaborating. So in the district, we kind of have technology separated a little bit. So we have information technology, which is my department. We make it run. We deal with the security technology. And curriculum's taking the helm on more and more of the education/instructional technology. So all those teaching apps that are kind of online based that my department doesn't have our hands in the pot, because we don't necessarily have to install them, or so we don't have the expertise on those. So Brenda and I collaborated a lot, and we felt that in terms of hardware, that the Chromebooks, the laptops that the teachers had, the docking stations that we've got in the classrooms, and we're trying to get more of these document cameras that are USB based, are going to be the best tools in and out of the classroom because of portability for the students and the staff. In terms of learning platforms, a lot more of that came from curriculum. I do know software like Screencastify, which we were using the trial version. I believe full licenses have been purchased. I think they've got several other ones, but I can't speak to the exact ones because I didn't put that purchase order through. So most of it's on the software, the application side, trying to unify, get the paid versions, and making sure that everything does talk to the best of its ability. Some of the applications were only used, say, 7 through 12, and now they may be extending it to lower grades. But as much uniformity as possible to minimize the amount of technology, whether it be hardware or software out there, has been pursued. Any questions?
Any other comments for now? Well, thank you very much, Kath, and we look forward to reading it in detail and commenting. And thanks for all your staff and all your work on this. Andrew, you had a question? Andrew?
No, that was just my computer dinging.
Okay. Well, no more on this right now. We look forward to getting it comments, and you'll submit it on Friday as the draft plan, right?
Mm-hmm.
And
Yeah, Bob, I did have some questions. I guess I forgot about asking when we're going to know more. I know I keep on harping on this, but I just feel like it's critical to knowing exactly what our situation is going to be like starting in September, when the staff discussions will take place, and when that kind of contractual kind of information might start. I imagine it's not going to be a single day or a week process. And I just think the sooner that we have information on how many staff members we actually are going to be having come back to school, I think the the easier it is going to be to plan accordingly in September.
We had said last time that by August 1st, we wanted to know from parents and staff what the, what the decision was. So we could, because, we know the structure, we know who we need, and then, we can work and make those placements and see where our gaps are. And if we need to change, change any of the instructional design, hire new people, flex how we're teaching. Another area that I forgot to mention to all of you was our looking at, a way, I may have mentioned this to you last time, of how we can minimize the number of high schoolers in our building by not requiring 11th and 12th graders to, if they're meeting their graduation requirements, not to require them to take their elective courses, thus reducing the number of students in the building, as well as potentially giving us greater staff availability, and also looking at students being able to kind of come in late or leave early if they, if that's how their schedule works. And rather than that just being a senior privilege, extending that privilege to other students. So really looking at, keeping abreast of what are we learning about high school students, and if we're going to minimize and then maybe really have to pull back on in-person, what are some of the things we could do preliminarily?
And another question I had was on the aspect of school closure and determination from our local health official versus on a more state-based. Have you gotten a sense from our local health official what his particular stance was? And are we anticipating getting state guidance at some point in the next month? I mean, it would be a shame if it's one school district somewhere else is closed and it's just an outbreak in one area, to close the entire state. And I also would love to know, if we have if it's one case in our school, if it's two, like what threshold are we going to be at to kind of move to a complete distance learning program versus not? I think just from a planning standpoint, it would be helpful, because then we know to some degree what the probability is that we'll be in a particular type of learning. Because if it's one case and that's the trigger, then I would say the inevitability of that is extremely high, and we should really start shifting our resources to really distance learning focus. If it's like we're going to tolerate cases in our district, then I think that we should maybe refocus on the hybrid, or we should really focus on kind of in-person learning aspects. And it's just helpful to have that information, I think, from a planning standpoint.
And we agree. And we've got, this trifurcated focus right now, this plan, and then every now and then we'll go like, this is never going to happen. Why are we spending so much time on this? Maybe we should be focused on this. The last time we met with the health director, we were kind of sharing that same sentiment. Like, can we get some guidance, like kind of clear guidance, this percentage, this many cases, and what will the protocol be? Because in the plan, it talks about identified cases that would cause a 2 to 5 day absence from school for deep cleaning. And what they're trying to do as health directors is to make sure that they're all aligned, so that someone who has a health director in another district but the same kind of health data that I have isn't getting a different kind of information. We get a little concerned about the snow day effect. You called it, now I'm going to call it. I just had a little bit of black ice. You've got 6 inches and we're all out. So we want that information. I know that they were meeting as local health directors with the state, with DPH. Okay, it's still, I'm thinking it was last week. It was yesterday. So I think it's Wednesday. So they're meeting this week on that, Andrew.
Great.
And I will follow up with an email to our health director when we're done with the meeting.
Thanks.
Victor, it looks like you're raising your real hand, not your virtual hand. No.
Thank you, Kath. So this will go out for submitted to the state on Friday, and then public will have availability at the, right?
Yep.
Okay.
So
Any other
will we get opportunities, like what's the open period for editing this, or after it goes to the state, it can continue to be edited? And
It can still be, we can still make changes to it. It's going in as a draft with the understanding that, you know, that things will and can change. I think that ultimately when the board votes on it, you know, you'll be voting on it with the understanding that if there are changes or edits, it will come back to the board before it's put into the plan. And we can get some language for how to do a vote like that. I'm done talking, Bob, momentarily.
All right. Are we back? All right. The next item is committee report, student achievement. Victor?
Yes. Well, student achievement met yesterday. We were presented with a list of new high school courses, which included an EMT course, field experience in science and technology, field experience in careers in arts and entertainment, an equity course, which would involve reading a common book and involve actually everybody in school, as I understand it. Various other studies, women's history, street law, which is a practical understanding of the law. Perhaps most significantly, the introduction of an algebra sequence which will run algebra over 2 years instead of 1 as an option to the current offerings, which are either 1 or 1.5. We also, so that's unfortunately, of course, whether these courses actually happen depend partly on COVID. The EMT course is already canceled, and as well as on whether any students actually want to do the offerings. So I just want to give credit that in fact there's been a lot of thought into making new courses, and in the current circumstance they may not happen. On the other hand, a second item is that the board will be seeing requests for 3 new textbooks, which are both physical books and online services, which will happen next week when they can be on the agenda. Our approval is required. The committee, the Student Achievement Committee, approved forwarding those recommendations to you when we will see them next week. We will see them next week. Single academic approach in the current pandemonium, if you will, the pandemic pandemonium, the transformation to a single academic approach is at least temporarily on hold. Is that correct? Do I have that right? Yeah. And that's it. I'm sorry, I can't go on for another 20 minutes.
Thank you. That's okay.
I can't even compete with Kath.
Any other comments on student achievement? If not on policy, Bob?
yeah, good evening. This evening on policy, there are three brand new, the policy committee voted to send 17 policies to the full board for consideration. So we'll be forwarding those drafts on to the rest of the board members this week. And in next week's meeting, we can discuss approval of those policies. There were three brand new policies, one on health and safety protocols, one on personnel as it related to the changes in the regulations in the orders, temporary policies and regulations. So those three were approved. There were also revisions to policies, the board bylaws on meeting conduct, the community board operations, the green cleaning programs. On the green cleaning programs, one item that was discussed was that there was a letter from the public this week asking about the material safety data sheet availability of the cleaning products. So this policy doesn't specifically call for that, how do we make them available? So we just had a general question about how we administratively can get those available to people. We also have use of school facilities. In that one, it says that the use of the school facilities may be restricted by the superintendent. There was a little bit of discussion on whether that should remain a may. So when you read that policy, whether that should be a may or will, should the Board of Education just say, look, all internal facilities are shut down to public use, period, or not? I think the general consensus is leave the policy as it's written. We'll have that discussion next week. The other policies, visitors and observations in schools, volunteers, employment and student teacher checks, use of the district's computer systems, annual notices, truancy and chronic absenteeism, health assessment screenings and oral health assessments. There was some discussions about that. Student discipline. In student discipline, one of the issues was about that masks are now included as part of the disciplinary process. And it was suggested that we look at a separate standalone policy or a definition of what a mask is, what's acceptable, what's not acceptable, that kind of stuff. I think some of that's already in the plan that we're seeing, but just keep that in mind as you review this and the document Kath just reviewed with us. Student use of the district's computer systems, transportation, and use of the private technology devices. So those 17 will be in your inbox, so you can all take a look at them and enjoy the reading, grab a big, strong cup of coffee. We tabled equity policy discussion because of time and then went to public comment. And in the public comment, there was there was one comment that was forwarded to me in writing, and then one person spoke to it. The draft policies that we were reviewing, we had access to in advance of the meeting. We were reviewing them. We were discussing them. It was rather cryptic to everybody on the phone because where they could see the policies, no one was bringing them up on the screen. They hadn't had a chance to look at them. They didn't really fully understand what we were discussing. I think Kath mentioned at the start of this one that the policies, the draft policies we just approved, will be available for the public before our meeting next week of the full board to approve them. Maybe we just need to make them available a little more in advance to satisfy the public. That is pretty much a summary of what was discussed at the policy committee meeting. Does anyone have any questions?
I have not a question, but just a comment. Isn't it remarkable? There was public at the policy committee meeting. Wow.
It was actually quite a few. Was that a proper summary for those of you on the call? Anything additional to add? Did I miss anything?
That was great, Bob.
Okay, thank you.
Great job.
The next item is communications. I've had several, but one insignificant from Nicole Ercolani, who is concerned about essential workers. And Her basic issues are, if I'm working, I can't be there for distance learning. I need, or if I can't be there for the hybrid learning for part-time, and my kids are at daycare, and and at daycare, will they provide the necessary support to do the education when they're really just there for watching the kids? So that she had concern that under distance learning, her kids would be subject to only the daycare program and not subject to assistance during any learning. She also had concern about the time and the cost, and the cost for daycare at Dolphin Day, as she indicated, would be about, for full time, would be about $1,000 a month per kid that was there. And if they weren't in class, then she would be dealing with those expenses for the times that they were not in class. So her issue was with essential workers. However, most of the people who go back to work will now be in that category of the same problem as well, if they don't have somebody at home with the students. So that is a kind of a really rough summary of her major concerns. And I think she's got support from other people on Facebook that are issue with the same kind of concerns of how do they deal with taking care of the education while they're not at school. So that was probably the biggest issue on communication. There's lots of other stuff coming from CABE, the board chairs, but I think I've passed most of that on to everybody. And I know that that issue is that Nicole raised is going to be an issue for many parents as they go back to work, and how they're going to deal with kids that are not around. Maybe I just heard that the Senate is looking at $105 billion for education support. Maybe that money ought to be focused on parents. Anyway,
Pretty sure it's going to be an issue for every working parent across the country.
Yes. So anyway, that's any other communication?
Not just essential workers.
Right. Yeah, we did talk about it. Virtually everybody who has to work is going to have
Exactly. Or even people, I was thinking like myself, where you opt to not go back to work because of the situation. So you're choosing not to have a second income. So, I mean, there's a lot of families like that too.
So I think that's an issue for, whole policy issues, is an issue for the general public, it's an issue for the governor, it's an issue for all the people going back to work, and wants to figure out how that be dealt with in the future.
Yep.
Any other communication?
Yes. Last night at the Board of Selectmen meeting, I gave them a rundown on what the school district is doing to prepare for the return to school. I did discuss the magnitude of the effort and the tax that it's having on our employees to get ready to go back to school, and how they'll probably be fatigued at the point that the school system starts. So, but all of the heroic effort, everything that's going in. My fellow selectman on the board, Carol Befithis, asked the question, is there anything that members of the town can do to volunteer to help the school district at this critical time? That, she personally would be interested in doing any type of volunteer work, and she's sure there's others as well. As I listen, I did say that much of the planning that's going on in the heavy lifting there is very school process and procedure related. So it's going to be hard for a volunteer to come in, but that there may be things, and that I would bring it up at this meeting tonight, which I'm doing now. But like Kath, when you were discussing, well, we might need bus monitors. The question is, could we use volunteers to do the bus monitoring? And then during the policy committee meeting we just had, there is a policy on volunteers and the groups and what we need to do to certify that they're able to work in that capacity. So these things all come around, but so I just wanted to, as the staff and the administrators and all of the workers at the school are working through these plans, if there are areas once the school opens that volunteers could be used, let's make people aware of that. Or even during the planning and setting up the schools and some of the work that's being done in advance of the students' arrival, if any of that could be handled by volunteers, please let us know. We have ways of communicating it to the public and maybe getting some volunteers. I'm a little skeptical that we'll have that need or be able to open up the doors to volunteers. But, I just wanted to let you know that people are thinking that way.
The only way you can be a volunteer and a bus monitor is if you're also a Board of Education member. And isn't Carol a massage therapist?
Yes,
Because I got a knot right here, so she can volunteer.
Great.
Oh, that really means a lot to us. And, I have to tell you, Bob, Laura Francis in yesterday's planning and response team meeting offered the same thing on the part of the town of Durham. And we literally reached out to her today to say, can your town crew deliver the tables from the Durham Fair? Like something, then it's not even little because that's big, but to be able to be working in collaboration like that with the towns is huge. So we will definitely consider that offer, and please let her know we said thank you.
I will, and I did say to some people not too long ago that right now working in public service for these towns is probably at one of its most challenging times in terms of the different issues, the budgetary considerations. But I also find that it's probably one of the most rewarding times to, and one of the most energetic time, because when you look at the way the school districts, the towns, all of the departments in the town are all working together and pulling together to try to get through the COVID issues and the budgetary issues and so forth. And the level of cooperation, it's exciting, it's exhilarating, it's exhausting all at the same time. But I just, and I want to thank my fellow board members here for all of the time you're putting in and all the effort. So thank you to all of you as well. So it is really quite a time.
Great, thank you.
Thank you, Bob.
There was also the email from Kelly Davis, Bob, just like for the record.
Yeah, I was just going to say that myself. Yeah.
And also, I still don't think, I know it's not really a Board of Ed issue, but parents still have not gotten their refunds from Middlefield Park and Rec for sports camp. So I don't think that Hannah has been very responsive to those parents. And I know I asked a few meetings ago that maybe some of the Middlefield Board of Ed reps could help kind of bridge that gap for them.
Yes, you asked, and I did not reach out. I'm sorry, I dropped the ball on that. I will reach out.
Well, I appreciate you admitting it, Bob.
We love you anyway, Bob.
Thank you.
Yeah, thanks.
Hey, I call them the way I see them, and I own what I own. I am who I am. There's no. I dropped the ball. I completely did not reach out about that, and I will. So,
Missy, any question? Missy?
Oh, no, I was just going to mention Kelly Davis's email. I just wanted to make sure that was on the record. That's it.
Bob, I also saw communication from the social media that there were people that were concerned that mostly, I guess it was essential workers that were concerned about what was going to be in place for them if school was closed. And then my concern was that it seemed like their impression was that the school district was in charge of providing some kind of childcare for them if the school district was to close. And then also there was some kind of miscommunication, I thought, as far as where the beginnings of us correlating with Dolphin Days became, because to me it came about from the need for just full-time parents wanting child support like 6 months ago before this pandemic even started. But yet what I've seen on social media was some kind of miscommunication as far as assuming that the correlation or the joining with Dolphin Days was our way of having Dolphin Days assume the responsibility of the childcare or even the education of students if the school district was to close. And I felt that was not correct. And I just wanted to clarify that.
Yeah, it was not correct that we got into Dolphin Days to discuss a before and after school program during, when we start that last February, Kath? And so the discussion is really about having, Dolphin Days run the before and after school program. They are now looking at use of Brewster School in their own facility as part of that. Are we lost? Kath, can you hear me? Can anybody hear me?
Yeah, we can hear you.
All
Yeah,
right.
you're good.
Oh, y'all look frozen. Any other comments?
Well, I think it's worth in that context remembering that actually Kath brought a proposal to the board for development of a before and after school program years ago.
Right.
Yes.
I hate to say how many. So it's
Way
not
before-
even a matter of 6 months ago. It's more like 3 years or 4 years, I think, Kath. Do you remember when that happened?
How long have you been board chair?
Yeah, was that 5 years, 4 years now? Yeah.
Because Carrie was still board chair. So, but you know what? At the time, the decision really by the board was a preference not to have a district run before and after care program for a number of reasons. And so we just kind of stepped away from it, but the need still remained. And then, Dolphin Days reached out. Oh, yeah.
I think unfortunately what's happening is I know that the original intention was for working parents and to have an after school or before and after school program as we used to have for BASREP. But I feel like the consensus of some parents is that the role of the before and after school program right now for Dolphin Days is because of the pandemic, and to take the role of helping students and to work with students on their education in the place of the school district, from what I've seen on social media.
Well, that's not the case. So, Kath? Thanks, Mara, but I mean, that's clearly not what the purpose of Dolphin Days is, or are they capable of providing that service as far as I know.
Thank you.
The other new business is the Corn School Building Utilization Committee. Andrew, do you want to mention that?
Yeah, I think we just wanted to bring this up because it wasn't really on the agenda item last week. Just to make sure that everybody was okay with the letter being sent to the towns, just specifying our intent to move forward with the demolition of Corn School and the financing around that. We additionally wanted to provide, I think, some of the rationale within the letter given the current finances. I don't know, Bob Martino, do you have any other thoughts or anything else? I think this was mainly just put on the agenda to create dialogue unless anybody had any problems. But, you know, I think Victor and other people had previously felt like we've kind of already voted on moving this forward. And really this was more of a courtesy component just to allow people to speak up if they wanted to.
Yeah, I think that what we heard at the last utilization committee meeting that was a little bit different than what we'd heard in the past is that despite best efforts to maintain the building, that, you know, when you mothball a building for a period of time, even with maintaining the heating and ventilation system, you do get issues like we are starting to see mold build up on rugs and some locations. So the ability to, you know, do a turnkey and open up the school immediately or what have you for use even within the district is no longer a viable option. And at this point, it's been going on for so long that at this point, it's the feeling of the utilization committee that we should move forward with demolition of the building. And as a courtesy, notify the town that the town of Durham, that is our intent, because Durham has not been able to move forward. In addition, we were gonna, Kim has some additional information for what it might cost to remediate some of the issues in the building and to provide that information as well. And this is information above and beyond what we had been looking at before in terms of what would be needed to make the school operational. So that's, or the building operational. So that's kind of the color behind it. I wasn't sure if we were looking for a vote tonight on whether or not to demolish or to, but I think the plan of the utilization committee is to now put it as a referendum item to bond the cost of demolition. And so I think the school, at some point in the budget process, the school Board of Education will need to vote on whether or not we want to have that as a referendum item in the next budget season. So at this point, I just open it up for discussion. And Bob, you were in attendance at the meeting. I don't know what your viewpoint is, and I'm not sure if you've heard anything different from the town at this point.
I haven't, and my sense is the board's authorizing me to write the letter. I will put together the letter with the information that Kim has provided. And it'll be just a letter to the town to basically seek their advice if they're still planning to move ahead and give them the current information on the building. Is that correct?
I move that we authorize Bob to write a letter to the town with the contents that he just described to us.
Since we're doing this, have a second?
Second.
Everybody in favor?
Aye.
Aye.
Aye. Does us authorizing Bob to do that, is that a de facto vote for moving forward with the funding for demolition in the event that there's no response from the town?
Well, the question of how to move forward with the funding, I think, is a separate question, Bob. But we already had a resolution which passed, I think, a year ago, choosing a deadline beyond which we were committed to developing a demolition plan.
Yeah, I do definitely still think we need a vote on the actual movement to the referendum, and there's obviously needs to be a lot more discussion around the financing and the whys of everything. But I agree with Victor on just the general sentiment and the plan moving forward, that we've kind of already voted on that in the past.
Right. All right. Did everybody else? We did vote on that, all right? Yes. The next item on the agenda is I've had a volunteer who was Kristen Olszewski. You might remember her as that she was running for the office in the Board of Ed. She has talked to me several times about the volunteering to be on one of our subcommittees. She's a full-time licensed real estate agent with and a mom of a 7-year-old at Lyman and 9-year-old at Memorial. She's been a treasurer of the Lions Club, den leader of the Cub Scouts. She's treasurer of the Lions Club as well. She's also been involved in a degree or an institute for holistic health and coach, and working with individuals on various challenges for goals and looking at their health challenges. And she is interested to serve on our well-being committee. I talked to Maura quickly about it, and I think she's obviously very interested in providing some assistance and working with us. And I think working on the well-being committee would be a good addition for her. And if I have your approval to vote on the acceptance of her, or any other comments.
I'll move for approval.
I second.
Any other comments on it? I think that she showed a really appreciation the night of the election to come forward and ask if she could volunteer, and I'm pleased that she did, and I think she'll be a good addition to our well-being. All those in favor?
Aye.
Aye.
And thank you, Kirsten. I'll send you a letter if you're listening.
Thank you.
Yeah, okay. Next is public comment. Again, Ken will provide the access to the public comment. During our board meetings, we will accept public comment. We don't normally respond to it. We will accept it and listen to it. And anybody who can stay as long can write me their agenda, and I will respond to it as well. Ken.
And I'm gonna be timing the public comment. You have 3 minutes. I will give you a 1-minute warning when you're at 2 minutes.
Okay, there's currently 2 callers indicating they wish to speak. I'm going to read off the last 4 digits of the phone number and ask the public to read or call out their name and their town prior to their comment. The first one I'm going to acknowledge, the phone number ends in 0021.
Hi, my name is Nicole Ercolani. I'm a Durham resident. And I'd like to address some of the comments that were made about my specific email and conversation with Mr. Moore. For lack of time, I'm just going to focus on the child care aspect. So there was a female Board of Ed member that made a comment about some misinformation about daycare. So in the informational meeting last week, I specifically asked the superintendent about full-time daytime daycare. My question was not in regards to aftercare or before care. In the response email that we got the following day, my question was addressed very specifically as full-time daycare. And the superintendent did say in her response that Dolphin Days, I will read it to you actually. Sorry. Is the school making any provisions for supporting parents who are essential workers or people in the professions who must work during the day? We are working with Dolphin Days, a local child care center, to expand available child care by extending their setting to include a site at Brewster School. Cost to participate will be dictated by Dolphin Days rates. They are also working to expand their full-day child care offerings for school-aged children. In the event of a school closure or children on non-school days, we will implement the hybrid model, which would mean students are attending school on an alternating day basis. So there's no misinformation there. My question was very clearly addressed by the superintendent, and in her response, she specifically mentioned Dolphin Days. On the phone call last week, she also made a comment about bringing in National Honor Society students to the daytime program provided by Dolphin Days to provide ongoing assistance. So I would like to defend my statement and say that no, there was not any misinformation in what I understood. My issue with it is that essential families, and I understand that at some point we will all be back to work, but I am specifically speaking for essential families because that is my personal experience, and I've had over 80 families
You have 1
reach
minute
out to me.
left.
Okay. I've had over 80 families reach out to me over the past week about specific concerns. I do feel that if you're going to promote Dolphin Days as a private private environment for education purposes, which was very clearly stated by the superintendent that this needs to be put into the budget. I do think that the budget can be looked at. I'd like to make address a comment that was made by the board member who was addressing finances when she made the comment that there is no cost to parents other than school lunches, because I think we're neglecting a large population of the community in that we are going to have to pay for childcare. Those of us who've been working outside of the home since March have been having to figure out childcare for over 4 months. And to extend that ongoing to the community, I just think is honestly frustrating that this is not being addressed more. And I understand like maybe it needs to be escalated to the state level. And if that's the case, then that's where we'll go with it.
I'm sorry.
But I think that it's a large enough group that it would be considered discrimination against these families if this is not specifically addressed. The other issues that I brought up with Mr. Moore in my conversation were quality of education, which I think actually the superintendent spoke to during the meeting. So I appreciate you recognizing that. And then time management, which obviously if someone's working outside of the home and they're not able to provide guidance to their child during the day, they have to come home after working a shift and provide guidance at night while still doing all of their normal household routines. Also, parents brought to my attention mental health.
I'm sorry, your time is up. I told you your time was up.
Okay, well, thank you very much for my time.
Okay, we've got one more caller that is indicating they wish to speak. The last 4 digits of the phone number are 6372. Please state your name and your town.
Hi, Gwen Hutter, Middlefield. I just wanted to say, so I'm a teacher in New Haven Public Schools. So a board member earlier said that doesn't seem to think that, we need to worry about other counties. And I have at least 10 friends who have students in our district, and they all teach in other districts. So there is an importance for us to be cognizant of the school day snow effect, because it does affect a lot of children in our district. Also, I was just seeking clarification for the frequency of parents having to sign off or self-certify that their children are healthy. Would it be daily? Would it be weekly? Would it be per household? Would it be per child? And then this is my 16th year as a special educator, and one thing I've used in my past experience that worked well was when kids had to go for movement breaks, weather permitting, it always be outside in a clockwise manner. That way, 2 groups aren't facing each other face to face, but they get to take their masks off nowadays. But also, me as a special educator, I leave 5 minutes early. We do a full building loop, and then we'd go to the elective. It was just an idea I've used in the past, and it worked well for the school buildings that have the doors going outside. Another idea for mask breaks. I personally have one of those 10 by 10 open tents, and I bet a lot of sports moms and people in scouts or whatever, a lot of people have those. I personally be willing to have my son's classroom teacher or daughter's classroom teacher put that outside their door, because I know a lot of parents have asked a lot about mask breaks. Maybe it could be a classroom policy, just like you have a policy of going to the bathroom. It could be a policy of like at Lyman, they have doors outside. They just stand under that tent for 2 to 3 minutes. Maybe give them a dollar store timer. Each one get one at the beginning of their put in their backpack or whatever, and they're going to get clear buckets. Put it in their clear bucket, and they go out for a minute, 3 minutes or whatever, sit, walk, take their mask off, but it be within the teacher's supervision. These are just ideas I thought would help, again, with some of the community helping out and offering suggestions. Thank you very much for your time. Gwen Hutter.
Okay, we've got another caller. The last 4 digits are 8344. Please state your name and your town before you comment.
Hi, my name's Mariah Roy, and I'm from Durham. I just wanted to say that I just wanted to give credit to everybody at the Brewster school system. I'm also an essential employee. I'm a nurse. I work in the emergency department. So since March or February, when all this COVID started, it's been stressful at home. with a lot of things with my son, but I think the school has gone above and beyond. Sure, childcare is very difficult, but I would rather come home and spend an extra 2-3 hours, no matter how tired I am with my son, than spending an extra 10 plus hours at work, which I'm averaging a week now because of all the stuff with COVID. It's very difficult. Every family has their own unique situations. I mean, you have to think about the people who are totally out of work right now, and maybe they're having trouble paying their bills, their mortgage, their internet. The essential workers are blessed that we have the capability to work and bring home a paycheck, and most of us are getting paid out overtime. That's obscene because of all the critical stuff going on. You have your child's health, your family's health. It's going to be very difficult, but I think this is not something to be put on the school district. You need to contact your employer as well. If it's childcare that's the problem, then there's other resources you can have. That's not to be put on the school district. The time you put in with your family and to educate your child, that's completely different. I know it's very stressful. Everyone has their own stressful times, but I don't think it's fair to be pitting essential families and non-essential families against each other because everyone has their own unique challenges. So that's all I wanted to say. I think the school system's done an amazing job. My son has special needs, and the whole district, everyone we have contact with, his therapists, have gone absolutely above and beyond to make sure that he's getting what he needs. So thank you all very much. I understand the decisions you have to make are difficult every day, and they affect a lot of families, and I think you're doing a phenomenal job. So thank you.
All right, we have another caller. The last 4 digits are 8021. Please state your name and your town.
This is Candace Burritt. I live in Durham. I have twins in Brewster School, and according to the thing that you showed today, if they're in K through 2, they're going to be using Seesaw again. Seesaw did not work for kindergartners who cannot read. It means the parents are being teachers. I did not go to school to be a teacher. That is what the teachers are supposed to do. You need the Google Classroom for the younger kids too, not just Seesaw. I went to school for forensics. If the class they were teaching was crime scene photography, then I could do it. I cannot teach everything that they need to do because that's not what I went to school for. Also, Nicole she wasn't just advocating for the essential workers. She's advocating for everybody who has to stay home and teach their child while they're trying to work from home. But the cost is an issue more for essential workers than it is for those who have the privilege to stay home and work from home. The essential workers do not. Also, with twins, nowhere everybody's saying, oh, call the principal. You should have something set in place if you're trying to keep cohorts together. Why would I have 2 kids that are the same age in 2 different classrooms that now could affect 2 different classrooms and have them have to be quarantined if, God forbid, as an essential worker, something happened to me? We pay a lot of money in taxes for education. 70% of our tax money goes to the school system. And if you guys can't teach the younger kids, then something needs to be changed. I already sent an email and none of those things were addressed. None of them were even brought up. All that got addressed was we're trying to change things, but nothing says how you're going to work distance learning for the younger kids. Also, early education centers don't require masks for kids. Why do we need for the lower?
This is your 2-minute warning. And can you please restate your name because we missed it?
Candace Burritt. And the daycares don't require masks for the school age kids. Why does the elementary school require it for the school age kids? I can understand requiring it for the older kids because they are more prone to spread it. But if you look at the science, the younger kids do not spread it as much. These are things that need to be addressed and figured out. I'm done.
We have no other callers indicating they wish to speak.
You're muted,
We've got
Bob.
one more just popped up.
All right.
Last four is 0021. Please state your name and your town.
Sure, if I'm breaking rules by calling in twice, but considering no one else wants to speak, I'm wondering if I can have a little bit more time to just say a few more things. If not, it's totally fine. Hello?
Is this Nicole again?
Yes, I'm sorry, it's Nicole.
You have another 2 minutes.
Okay. I mean, I just want to respond. I'm also a nurse, and I did bring this up on the meeting. I've been contacted by several other healthcare workers, and the nurse that spoke on the phone, I'm working 10-hour days too. I'm working with COVID patients. So I definitely think it's admirable that you are willing to come home from that long day and work with your kids. And that's what we've had to do this entire time. But long term, is that really feasible? I mean, I'm assuming at some point we'll probably have to have distance learning in some capacity. I agree with what Candace said, that, you know, we paid for text for a reason. I think that the school budget needs to be reassessed. I mean, we just bought a playscape. We don't even know if kids can go on it because of social distancing in the pandemic. I'm just wondering if the school board can look at this at the funds available, and if not, then if we need to extend it to the state, obviously this is a statewide problem. So just because it's a statewide problem and not specific to Regional District 13 doesn't mean it's not a problem anymore. And I am advocating for essential workers. I'm also advocating for parents at home because a portion of my job does require me to work from home. So I understand how difficult that is when you're trying to do something from home and having to educate your kid as well. I'm not trying to leave anyone out. I would just like to see a plan that works for families across the board as best as possible. Thank you.
Thank you. Ken?
No one currently indicating they wish to speak.
Thank you very much. And we have a motion to adjourn.
I make a motion to adjourn.
Second.
All in favor?
Aye.
Aye.
See you all next week.
Bye, everybody.
Bye. Thanks.